One of the contraindications to do LASIK is if it's too thin. Now, how thin is too thin? First of all, let me tell you what normal corneal thickness is. When we look at a cornea, we have to look not only at the central thickness, but the distribution of thickness throughout the cornea. Average cornea is 520 microns in the center approximately. What that means is if you've ever taken a ruler and seen the markings, one side is the inches and other side is the centimeter. Now in the centimeter side, when you go down, each gradation is like a millimeter. Now half of that is 520 microns. If the cornea is thinner than 475 microns, currently the thinking is we should not do LASIK on that cornea. And some people don't even do LASIK below 500 microns. Dr. Binder's study looking at thinner corneas showed that there was not any direct correlation between thin corneas and any problems with LASIK. More importantly is the shape of the cornea than whether it's thin or thick. But having considered that and all other data available and what researchers like Dr. Rabinowitz and others say, I think the safe limit would be somewhere between 475 to 500 microns. If the cornea is thinner than that, again, like Dr. Lindstrom and others have mentioned, up to 450 microns might be okay to do surface ablation. Anything below that, we should not do refractive laser surgery. Why? Because we are worried about making the cornea very weak, leading to ectasia or protrusion forward, which is known as keratoconus. So besides the central thickness, that's why we always look at the shape of the cornea, which is obtained from topography. And similarly, in doubtful cases, corneal thickness can be analyzed using Galilei instrument or OCT and see if there is a big difference between superior cornea and inferior cornea, or there is any focal localized thin area. If we do find such, again, person may not be a good candidate for LASIK or even laser vision correction. And our suspicion should be very high in all the cases, but especially in people who are in their 20s to 30s. And if there is a family history of keratoconus, they are rub their eyes a lot, or if on corneal topography the abnormalities are detected. Because as always, safety comes first, and for that reason, no patient should have LASIK without having a corneal pachymetry, which means measuring the thickness of cornea. Thank you.